I hear it all the time. Dentists will tell me, well, my older patients, they keep hitting me over the head. Well, I'm on a fixed income. I'm on a fixed income. And for some reason, dentists are irritated by this. Well, let me tell you a little bit about fixed income, okay? When a patient is considering complex care dentistry and they're still employed, they're paying for their dentistry out of cash flow. The level of the fee feels much more shocking when the patient is paying for their dentistry out of their life savings. And so there is more financial risk for patients who are on fixed incomes. So in their mind, they're thinking, well, number one, I have the risk of, will the outcome provide me really what I'm looking for? Let's say the patient's been wearing dentures or partial dentures for years and they hate them. And now the dentist recommends a lot of ceramic, a lot of implants, a lot of clinical risk. So that's one risk that the patient is looking at. But for the patient on fixed income, there's the additional financial risk that really, it doesn't exist as much on this side as it does on this side. Oftentimes, patients on fixed income will be as worried about the depletion of their savings more so than achieving their clinical outcomes. Here's the second point about patients living on fixed income. If you rehabilitate a patient, I'm talking about posterior implants, anterior ceramics. If you rehabilitate a patient and they pay for it out of cash flow, and now 5-10 years later, they're on fixed income and there's a complication with the dentistry, it's a double-edged sword for the patient. Not only are they disappointed that the dentistry failed, but number two, they got to pay for it out of their fixed income. And this makes them far more susceptible to seeking second opinions, legal issues, and just basically being very unhappy with you. So be careful when dealing with patients who are doing your dentistry or are about to go to fixed income. Be really careful about you acknowledging that you understand that they're concerned about the depletion of their savings. If you'd like to learn more about my upcoming workshops or the online treatment acceptance mastery curriculum, click the link in the first comment below.